Welcome back to this course on ACL injury rehabilitation. The week 7, return to sport and sport-specific conditioning. Lecture 31, functional movement screening for identifying biomechanical deficits. I am Dr. Jerrin Shaji from the Department of Sports Medicine, AFMC Pune. In this lecture, we will be seeing the importance of functional movement pattern. By the end of this session, you will be able to learn the role of balance and proprioception in ACL recovery, the role of functional movement screen in ACL rehabilitation, the biomechanical risk factors detected by screening, and the use of technology in functional testing. We will also be seeing the application to sports readiness. Now coming to balance and proprioception. What is balance? It is defined as the ability to maintain your body's center of gravity over a base of support, allowing you to remain steady while stationary or while moving. Maintaining balance while stationary is known as static balance, and while moving is known as dynamic balance. Balance relies on sensory inputs from the visual, vestibular, and proprioceptive systems, as well as central processing and muscular responses to keep the body stable in varying situations. Now, what is proprioception? It is the ability of the body to sense joint position, movement, and force of muscles, joints, and limbs without relying solely on visual cues. It allows people to coordinate actions, maintain balance, and make automatic adjustments in posture and movement. Specialized sensory receptors known as proprioceptors located in muscles, tendons, and joints constantly send information to our brain about changes in the body position and movement. Balance and proprioception training involves a structured exercise regime that challenges and improves a person's ability to control posture and equilibrium. This training can include activities while sitting, standing, and walking with varying difficulty levels designed to strengthen the muscles, improve the coordination of the sensory systems, and to enhance the body's ability to respond to perturbations or sudden change in balance. Example, simple tasks like standing on one leg or passing a ball while seated, to more advanced multitask exercises that add cognitive or motor complexity, such as standing on unstable surfaces or walking while performing mental tasks. Now let's see the effect of ACL injury on balance. ACL injury impairs both balance and proprioception. This is because all ligaments, including the anterior cruciate ligament, contains mechanoceptors critical for joint position sense and neuromuscular control. After injury, the deficit in proprioception leads to diminished postural stability, causing increased sway, poor control during single leg stance, and a greater reliance on visual cues to maintain balance. These effects, or rather deficits, persist even after ACL reconstruction, affecting both the operated and the non-operated limb, with underlying alterations in central nervous system processing and sensory integration. So how does rehabilitation help? Post-ACLR rehabilitation, specifically targeting exercises for the restoration of balance and proprioception through progressive neuromuscular, proprioceptive, and balance training, can successfully retrain these abilities, significantly improving joint function and overall quality. Now coming to the role of functional training post ACLR. Balance training is pivotal for re-establishing sensory motor control and dynamic knee stability after ACLR, as proprioceptive deficits and altered muscle activation can persist for months post-op. Objective balance assessments detect persistent deficits, help guide rehabilitation progression, and predict readiness for return to sports. Such tests examples are Y balance test. Neuromuscular control for landing, cutting, and deceleration are key to injury prevention in the field or court sports. Now, what is mobility and stability? Stability is the ability of the body or a joint to maintain control of its position or movement, especially during dynamic activities or when external perturbations or disturbance in balance. It involves neuromuscular control, coordination, and strength to resist any unwanted or excessive motion, particularly maintaining alignment and joint integrity. The role of stability in post-ACLR rehabilitation is that after ACL reconstruction, restoring the knee joint stability is critical to prevent abnormal joint movements, which reduce stress on the ACL graft and ensure safe functional activities. Now let's see what is mobility. It is the ability to actively move a joint or a series of joints freely through a full range of motion without pain, stiffness, or any restriction. It encompasses adequate joint flexibility, muscle length, and neuromuscular control to allow smooth and unrestricted movement. Adequate knee and related joint mobility are essential to achieve normal gait, squat depth, and force absorption during movement. Limited mobility can lead to compensations such as valgus knee collapse or altered loading, increasing re-injury risk. Together, mobility and stability training in post-ACLR rehabilitation provide the foundation for restoring functional movement, improving performance, and minimizing re-injury risk. These complementary qualities are key targets throughout all phases of ACLR rehabilitation. Let's see what is functional movement screening. FMS or functional movement screening evaluates 7 fundamental movements. The assessment of these movements can help the rehabilitation professional to determine who possesses or lacks the ability to perform a wide variety of essential functional movements. Assessment of functional composite movements is necessary before the assessment of highly specific or specialized motions or movements. The FMS is a widely used tool for evaluating these fundamental movement patterns in individuals with no current pain or complaint related to musculoskeletal injury. The FMS is not intended to diagnose orthopedic problems, but rather to demonstrate opportunities for improved movement in individuals. These 7 functional movements are deep squat, hurdle step, inline lunge, shoulder mobility, active straight leg raise, push-up stability, and rotatory stability. We will be seeing one by one subsequently. Coming to deep squat. This tests bilateral symmetrical functional mobility and stability of the hips, knees, and ankles. Using a dowel overhead, this requires bilateral symmetrical mobility and stability of the shoulders as well. The huddle step. The huddle step exercise tests bilateral mobility and stability of the hips, knees, and the ankles. This test also challenges stability and control of the pelvis and the core. Inline lunge. This pattern places the body in a position to stimulate stresses during rotation, deceleration, and lateral movements. Coming to shoulder mobility. The shoulder mobility pattern demonstrates the natural complementary rhythm of the scapular or shoulder blade and the thoracic or the chest wall region, the thoracic spine, and the rib cage during reciprocal upper extremity shoulder movements. Reciprocal movements are the movements of alternate sides in a different manner, such as the right shoulder will be moved upwards and the left backwards and behind. Coming to active straight leg raise. This pattern not only identifies the active mobility of the flexed hip, but looks at the core stability within the pattern as well as the available hip extension of the alternate hip. Trunk stability push-up. This movement is used as a basic observation of reflex core stabilization and is not a test or measure of upper body strength. Coming to rotatory stability. This is a complex pattern requiring proper neuromuscular coordination and energy transfer through the torso. This pattern observes multi-plane pelvis, core, and shoulder girdle stability during a combined upper and lower extremity movement. The image shows how the FMS tests can be done using simple equipment. Now coming to the scoring system for FMS. It utilizes a symbol grading for each movement out of 3 with a maximum score of 21. So the scoring is as if the individual is able to perform the movement correctly without any compensation, he is scored 3 for the movement. If the individual is able to complete the movement but with compensatory patterns like sway or imbalance, then he or she is given a score of 2. If the individual is unable to complete the movement pattern or assume the position even without compensations, the score is given as 1. If the individual has pain during any part of the movement, then the score is 0. It has been found by various studies that composite scores less than or equal to 14 has been linked to greater risk of injury. Let's see the role of FMS and functional mobility in ACL recovery. The screening helps in identifying mobility and stability limitations, asymmetries, and various compensatory movement patterns. The screening reliably identifies abnormalities such as poor core and hip strength, abnormal foot, knee, and hip alignment, asymmetrical or delayed muscle activation patterns, abnormal tightness of active and passive stabilizers. So FMS-based training post ACLR rehabilitation improves movement quality and potentially decreases the risk of future injury before return to sports. The various biomechanical risk factors identified during the FMS screening are dynamic valgus of the knee, that is hip moving inwards in adduction, and internal rotation with a limited ankle dorsiflexion. Decreased knee or hip flexion angles during landing is also detected. Trunk and pelvic misalignment or not in a straight line are detected, as well as asymmetric force production in both limbs. Modifying the risk factors which are identified by the screening can reduce risk of re-injury and optimize safe return to sport. Let's see the importance of technology in functional testing. The use of technology such as 3D motion capture and force platform, although which may be limited to well-equipped labs, provides gold standard data for joint kinematics or joint movements, ground reaction forces, and symmetry. Few affordable portable motion analysis system using even maybe a mobile or a tablet allows large-scale objective and flexible athlete screening. Few AI algorithms can reconstruct the movements, detect abnormal movement patterns, and identify at-risk athletes from real-time and recorded footages. These offer future potential for widespread early intervention while rehabilitation. Now coming to the application of these tools to sports readiness. Integrating balance, functional movement screen, and biomechanical or technology-based data yields a functional multi-domain profile of each athlete regarding his or her neuromuscular control, movement quality, and strength asymmetry. Screening also helps to make return to sport decisions and personalized late phase training. Various objective tests like hope tests, balance tests, and motion analysis, as well as subjective tests such as movement confidence and movement quality, are useful in this regard. Ultimately, effective screening and advanced tech reduce risk of re-injury, support long-term athlete performance, and improve confidence both for the athlete as well as the practitioner before clearance to full competition. These are my references. Thank you very much and have a great day. Jai Hind.